Ready?
As a preliminary matter, this is Dorothy Hertz, Chair of the Contract Review Committee. Please permit me to confirm that all members and persons anticipated the agenda are present for hearing. Bert,
Yes,
you have to say your name, please.
Bert Johnson.
Thank you. John,
John Balash.
Veronica Volchik, and Dorothy Hertz. Staff, when I call your name, please respond in the affirmative. Jericho?
In attendance?
Ann? Yeah. Anticipated speakers on the agenda, please respond in the affirmative, since you are here and present. Arlene O'Reilly. Thank you. And who are you here with? Addiction Solutions Nantucket. Thank you. Good morning. This is an open meeting of the Contract Review Committee. It's being conducted remotely, consistent with Governor Baker's executive order of 1st March 12th, 2020, and then again July of 2022, due to the current state of emergency in the Commonwealth due to the outbreak of the COVID-19 virus. In order to mitigate the transmission of the COVID-19 virus, we have been advised and directed by the Commonwealth to suspend public gatherings, and such the governor ordered suspended the requirements of the open meeting law to have all meetings in publicly accessible physical location. Further, all members of public bodies are allowed to or encouraged to participate remotely. The order, which you can find posted with the agenda materials for this meeting, allows public bodies to meet entirely remotely or hybrid, as long as reasonable public access is afforded to the public and that the public can follow along with the deliberations of the meeting. Ensuring public access does not ensure public participation unless such participation is required by law. This meeting will feature public participation. For this meeting, the CRC is conveying by Zoom app on the town's website, identifying how the public may join. Please note that this meeting is being recorded, that all attendees are participating by video conference. Accordingly, please be aware that other folks are able to see you, and take care not to screen share your computer. Anything that you broadcast may be captured by the recording. All supporting materials that have been provided to members of this body are available on the town's website unless otherwise noted. The public is encouraged to follow along on the posted agenda unless the chair notes otherwise. We are now turning to the first item on the agenda. Before we do so, permit me to cover some ground rules for effective and clear conduct of our business and to ensure accurate meeting minutes. The chair will introduce each speaker on the agenda. After they conclude their remarks, the chair will go down the line of members, inviting each by name to provide any comment, question, or motions. Please hold on till your name is called. Further, please remember to mute your phone or computer when you are not speaking. Please remember to speak clearly and in a way that helps generate accurate minutes. For any response, please wait until the chair yields the floor to you and state your name before speaking. If members wish to engage in conversation with other members, please do so to the chair. And public comment, after members have spoken, the chair will afford public comment to those members of the public who have joined the meeting via Zoom. Actually, this will be the opposite. We will ask the public, our guests, to speak first, and then we will go into questions, okay? Finally, each vote will be taken via roll call. Can I get an approval? We have established that we have a quorum with four,
For the record, Joanna has joined.
and Joanna is in. Hi, Joanna. And so we have an established quorum. Can I get an approval of the agenda?
Motion to approve the agenda.
Second.
Okay, Bert,
Aye.
John,
Aye.
Joanna? Ah!
Hi, yes, I.
Veronica? Aye. Hey, Joanna, you missed the crumb cake from New Jersey that's in here, thanks to Veronica.
I'm sorry, we had to leave early. So I'm in Vienna.
Oh, good for you. I'm glad you got out of here.
Yes.
Not to say that we're all not jealous, because there's only two of us sitting in the board, sitting in the sun in the room.
Nearly got blown away coming in though.
Yeah, right. Okay, first and foremost, I have a little something I want to say to everybody. I am honored when I sit and represent our board. And when I'm asked to represent our board by decisions made by people within this room as a committee, I am not honored when I'm thrown under the bus as the person that is coming up with ideas, or when things come about where town officials come to me and say, well, this was your idea, or you're telling people to do this. I'm like, whoa, stop. No. So my request is the clarification that everybody take ownership. If it's something that is their idea or their concept, I am more than willing to step forward and be our voice. I am more than willing to step forward and be our advocate, and I have done so and will continue to do so. But I want to do so knowing I'm doing it, and knowing it's something that we as a board or a committee have done as a group and have said, this is what I want you to do. Okay, I will not go ahead and make any application for this committee in our name without saying, oh, we sat as a board and this was our concerns. I want to know where we stand. Okay, that's my request of everybody. Because to me, it is not an enjoyable experience to be stopped by somebody who said, well, I heard, and I'm like, no. No, that is not true. Either it is coming from a board or it is not me. So I need to make that pretty clear, because I'm more than willing and have advocated for years for this committee and put myself out there to advocate. And I want that very clear with everybody. Okay. That's my statement. I have a letter that everybody just got out, that Ann just forwarded to everybody, which is and I have one correction to make in the total sum on that. I am off by $50,000. I'm sorry, I thought you told me 403,000, not 453. I did. So I apologize, everybody. So the number in the second paragraph would be 1,200. Sorry. And $93,514. Okay. I met Libby on the street the other day. I've actually got a phone call from Brian Turbert, or I had a call with Brian, and this came up. And then I met Libby walking in town the other day, had a conversation with Libby. Libby has already sent an email to Brian in regards to this. One of the things that Libby asked me about this money was whether or not this request would be a 1 year, or whether or not we thought it should go into the school budget. I personally, the first time we brought this question, whether this should be in the school budget, I do believe this should become not part of the CRC after the first year request, if they follow through. That is pretty clear from Brian. He doesn't know where he would get the money that we'd be requesting from this, but we will go ahead and request anyway. But he has said to me that they don't know where, and it is in writing in a response to me and Libby, and I think Jericho was in on that. But my recommendation would be that it becomes something that they take that sustainable amount and add it to their budget for this kind of program, if we get it in the following years. That this is not an annual request. This is a 1 year request with that additional request going into the school budget after this year. And I think that was something that my feeling talking with Libby was that she would be more comfortable with that. I'm going to let Joanna talk first, because it was sort of Joanna's idea. So I'm going to go back and let Joanna reflect on whether, are you comfortable with that becoming something that would be?
Yes, 100%. Yes, I am. And also last night we had the hearing for the school budget, and I asked Beth and Mandy if there was money in the budget for these types of programs, and she said yes, but she couldn't identify how much or what the programs were. So I do think it's super important to make sure that we advocate for this amount of money and make sure that there is some program put in place very soon. And I do think it's completely appropriate, Dorothy, for it to go back to the school after that.
Okay, thank you. So everybody got this letter. And with the change in the funding, are you okay with the And we'll make, I'll have Ann sort of go through it with me one more time.
Okay.
Okay. Okay.
Good.
Is,
Yes.
is everybody okay with that?
Yes,
Okay, okay, we're gonna take a vote. Veronica,
yes,
John,
Yes.
Bert,
Aye, yes.
Joanna?
Aye.
Thank you. Okay, you and I'll just do.
Thank you, Dorothy. Thank you for moving this forward. I think it's super important.
Oh, you're welcome. Thank you. Okay, oh, something is not in here.
oh, no,
Okay, sorry, can we add something that didn't get put in here by accident?
what's missing?
The, quarterly report.
Oh, yeah. Can we do that, Erica?
I don't. I sort of think that needs to be a separate agenda item.
Did we do this so many times?
Yeah, we did have it on there, so I don't know
Yeah.
how we
Yeah, it was,
It was on there when I added, I guess that it must have,
popped off.
yeah,
because it was on the original.
It was on, yeah, and it was on, we talked about it yesterday. Ah.
Yeah, I do think that needs to be on the agenda, because that is a,
The only person I know that knows the rules isn't here. Linda, where are you? I know, I just never called.
What is, Dorothy, what's the question on the rules? I might be able to help.
Thanks, Joanna. We originally had the, quarterly reports on here, and it looks like it got taken off by accident
yeah.
when this was rearranged yesterday.
So the agenda as it is, doesn't include the quarterly report.
It does not on this piece of paper here.
Okay,
It did
so
on
we
the
can't,
original.
we can't vote on them.
yeah, that's what I
Okay.
figured.
Okay. And we cannot discuss them, can we?
No, I don't believe so.
I don't believe we can
Joanna,
have any discussion on them, correct?
if it's not on the agenda item, it cannot be discussed unless there's an agenda item that says for items not considered on the agenda.
Or additional business.
Yeah, we don't have any of that on there.
No, we don't have it on there.
No,
Okay, I mean, I think just a recommendation going forward, we should always put additional business on there. That kind of covers us.
Yeah, we will. Okay,
Point of order, Linda is joining in. Speak of the devil, as it were.
yeah, a minute late, Linda.
Literally 2 seconds. Linda, are you there?
Yes.
Additional
I've
business.
had trouble with my computer all morning.
I had trouble with mine too, so hopefully maybe that's what the problem is and not my computer, because I was worried it was my computer. We will not be discussing, you're just coming in, we will not be discussing quarterly reports as we forgot to put it on this reform of the agenda, which got reformed many times. So we are sorry. And since Addiction Solutions is here, we've discussed other things already on the agenda. We'll give you extra time to talk. How does that sound?
Sounds great.
And just so Linda, so everybody knows because I don't think Joanna was on when you said your name and stuff.
okay.
So we're just gonna do it now, and
Yep.
that way it's on there for Linda too.
Mhm.
Okay, fabulous. And there's somebody else from your organization there? Did I see anybody else? I
Yes,
saw Maureen.
I believe, yeah,
Laura?
Maureen and
And
Laura
Laura?
Burnett, and I can't see anyone.
Hi, Laura, welcome.
There she is.
I know that we have one more person coming. I believe Marcia is supposed to come too. So I don't mind starting early, but
I'm here,
because, oh, you're here?
Liz.
Great.
Oh, Liz McCusker.
Hi,
right.
Liz.
Hi.
And
So what we'll do is, I'm gonna have everybody say their name, and then we're gonna start, and then if Jericho notices anybody, we'll welcome them in for comment, okay?
Okay.
Okay,
Yeah.
and so everybody just has to say their name, each one of you, one at a time. and-
Okay.
Okay,
I'll start. I'm Arlene O'Reilly.
Addiction
I am
Solutions.
Laura Burnett.
Wait,
Oh.
everybody's with, sorry, I'm Arlene O'Reilly with Addiction Solutions. Sorry.
Thank you. Just because it's recorded.
Got it. Yeah.
I am Laura Burnett. I'm on the Board of Addiction Solutions.
Liz McCusker, Addiction Solutions.
Dr. Jocelyn Duffy on the Board of Addiction Solutions.
Okay, well, everybody, welcome.
Thank you.
Okay, well,
Maureen,
Oh, yes, I'm sorry, you may have missed me. It's Maureen McAllister, and I'm on the Board of Addiction Solutions.
Welcome.
Thank you.
Mhm.
well, thank you for having us here and considering supporting Addiction Solutions. So to give you a little bit of background, I started working with Addiction Solutions almost a year ago in March. And they had gotten a grant from the Community Foundation to develop a film called The Boy Next Door. That was spearheaded by one of the board members, Marcia Egan. And Marcia was introduced to me when this started happening. And I began to learn more about Addiction Solutions and understand their challenges and really understood the need of what they provide to the community, which for me, out of sight is out of mind. If I don't hear or see anything about it, I'm not really paying attention to it. So when I began working with them, I started advocating more to amplify their presence in the community, and that lots of development aspects occurred. The board expanded into this amazing board that's very passionate and very active board. I'm very proud of them as far as how they are so loyal and dedicated to their mission. So here we are today because now we're looking to expand further. And the three categories that we're interested in expanding is the clinical hours, because right now, Addiction Solutions operates 2 days a week, and it's kind of 3 to 4 hours per day. It operates on a shoestring budget. Dr. Lepre is the founder, and he dedicates and donates all of his time to the clinic. And they also have a policy that anybody walking in the door, if you don't have insurance, it's no problem. They'll get it covered. Like, they'll take it on the chin or whatever it is that they do in the clinic. So when we noticed there, that the clinical hours needed more time because they are unable to see or meet the demand. At the same time, because of the development we were doing in 2022, the board realized that they need a business-minded person in the office doing the things that a business manager or business director would be doing, which is outlined in this grant. And then last but not least, keeping it a sustainable function, would be part of that business director's role. And then the final ask was the education and outreach, as I said before, out of sight, out of mind. And we're talking about some strategies as to how to reach different demographics in the community that are probably unaware of what Addiction Solutions provides as far as, medically assisted treatment programs, which are proven to be highly successful in people who are trying to recover from, alcoholism or drug addiction and so forth. So that's the overview of the grant.
Do you have anybody else up there that would like to talk to us about impact or what they see? And then we can ask questions.
Laura,
like
go ahead. Laura, go ahead.
Oh, honestly, I have been involved with Addiction Solutions since 2017, prior to their receiving a 501c3, and very proud to be on the board again with, as Arlene said, all the new board members. We have strategically gone through our ask significantly to why we need the requested dollars and what I felt, or all of us felt, I mean, with having 2 days a week, we've got staff working 10 hours a day. In this way, adding an extra day alleviates, overworking staff that we do pay, as well as it allows us to bring on another doctor or nurse or clinician, and allows current patients to possibly go in on a Thursday versus a Friday if they have to go out of town. And as we know from past experience, our numbers increase during the season. And all of you know our season is no longer a 10-week season. It's been greatly extended, especially past 2020. To where we feel the need for a third day is crucial to being able to provide the adequate care for the patients. So that's why we're asking for that. The business director, it takes many, many different levels, from the accounts payable to the donor software. All of us are doing this on our free time as board directors. Clinical tracking, and then on top of that, we have our most, what do I want to say? We are rock and run for recovery in the mid, or what do I want to say, October. We have that as our main resource for funding, and we need someone to help us run it. We have many plans for increasing the donations on that, but it's come to a point with the growth and everything we have that a business director was greatly needed. And we're looking at, our latest discussions are maybe 30 hours a week in order to fulfill everything that we've been doing. The education and outreach is everything Arlene said. The educational element can also go back into the schools, which I know Maureen has been working on, and the outreach within publications to let people know we're out there. We've been very, very fortunate in first quarter to receive free public service announcements in some of these publications, because we just don't have a lot of money to push that out, as well as what am I trying to say? For the outreach, I think I've fulfilled everything on my notes. Does
Right.
anyone else here have?
I
Maureen?
was just going to add, I was going to add briefly is that while we do have an enthusiastic and dedicated board, we need to rely on the professional services of Arlene O'Reilly, who has helped us with, as a professional, she helps us with our outreach to the community. She's helped
Right.
us with our grant application, and then also organizing our annual fundraiser. So while we're there to support her, that's where we're asking for some financial support in the education and outreach, because we need a professional to help us with that. And she's been amazing.
Some of it's
could I
been
s-
done too.
Could I say a short word?
Of course, please do.
So I've worked with Dr. Lepre and observed his organization closely, and he presents truly high quality care to a community that's being oppressed by addiction. And as we all know, addiction is increasing in the United States. He functions to provide medication-assisted treatment for all types of addiction and works with other agencies to provide counseling. You need both systems. You need medication and counseling to be successful with treatment of this disease. The care is often free. He's functioning often at a loss. And he provides care 24/7. So this is the only service currently on the island that can help in this fashion. And additional monetary assistance is really vital to our community to continue on and to expand.
Yep.
If you have any medical questions, Dr. Lepre and Aileen can't be here. Unfortunately, they're in the office providing care and don't want to leave the patients behind. I can answer any questions in that manner.
I think he did a very good job presenting to us on the first presentation about what
Yeah.
his passion was. I wasn't sure, because I can't see everybody on that screen. I just wasn't sure if there wasn't any, I knew that Liz was there and I wasn't sure if she had any comments or whether,
Liz, do you have anything you want to add?
No, other than, no, thank you. Other than
Okay.
that, I had been passion plea the first time around, so I won't go over that again, but just to what everyone has said this morning, it's, we're very appreciative of you looking at this grant, and it truly is needed. It's truly needed because because we get this grant and we do get someone in the office and another night doesn't mean that the volunteers stop what we're going to do. We will continue to work just as hard along with these other people. But that's the
Wonderful.
only thing I have to say. But thank you so much for the consideration.
And
Yeah,
I
thank you,
do-
Liz.
I do have one.
okay,
more
we have
thing
one
to
more
add.
comment here, yeah.
So I had found this report that's called the Nantucket Chronic Disease Report that I think
Mhm.
was published by the town in, I think it was 2020.
Mhm.
And this was before the pandemic, obviously, right? And you guys are probably familiar with this report,
I am.
but just to look at it and looking at, drug use among Nantucket youth who consider suicide
Mhm.
kind of hit me right between the eyes. And the numbers that we have here, I'm sure have changed drastically, increasing since the pandemic,
Yeah, they have.
So what as a person who does analysis and pays attention to what's happening in the trends in the community and stuff like that, I'm anticipating that the additional clinical hours are going to be needed because this is going to swell and it's going to continue to swell. And I think that having a business person at the helm in the clinic is required because you have to have somebody keeping their finger on that pulse, because the people who are currently in the clinic are the frontline people treating the patients. So, and then of course, the outreach is, to let them know that we're here, which I don't want to keep driving that point home, but.
No, thank you very much. Every comment matters.
Yeah.
I'm gonna go down with the people, Veronica, I'm gonna go with everybody out
Yeah,
there first.
Please
okay?
do.
Joanna, you wanna go first, please?
So basically what you're offering us is that the grant will cover a person who's going to work in your office and sort of man operations. That's what I'm hearing. Yes.
That
It
is
goes-
also
It goes-
clinical people.
Okay. So what is the breakdown of the amount that you're asking for the admin versus the clinical?
Oh, it's right
It's in
here.
here.
It's actually on the sheet on the very first page of their request.
I just
Yeah,
don't
the-
have it with
The
me.
clinical hours,
Yeah.
50,000.
It's 75,000 for the business director, 50,000 for education, and it is
50 for extended clinical hours.
50 for extended clinical hours.
So then essentially this money is really helping you professionalize this into a business.
Yes.
Yes.
Okay.
It will create the foundation that Addiction Solution needs to continue to grow and become sustainable.
Is there a projected number of people served if you're able to follow through on this model?
That would probably have to come more from the clinic itself, because there's confidential information as far as the patients that are going in there. I can tell you that it's not just walk-ins and it's a one-time visit. It's something where the person now is developing a long-term program to become healthy again. So on average, as far as how many people are served, I don't have that information, and I would refer to the board for that.
Okay.
But I would guess that from a business standpoint, most times you can anticipate between a 30 to 40% increase once things start to be managed in a way that is more elegant, more intelligent, versus the frontline people always there working on the patients, so.
Can
And
somebody
if that's
answer?
I'm sorry, if that's an important, we promise, question, we promise to check with Dr. Lepre today and try and get a better sense and get back to you.
Yeah, I think-
Joanna?
Yeah.
I think if you could,
Joanna?
hold on a second. I think if we could just get a number sent to us, I have a
Sure.
feeling it would be very simple and.
Right.
doesn't
I
really
agree.
do-
And I think Dr. Lepre knows it better than anyone. So as a board member, I don't know that we want to guess, but if you don't mind, we promise to follow up this afternoon.
No, that's
Right.
fine. It's great.
I
Hold
can
on-
tell
hold on
you
one
that-
sec- hold on one second, Jericho.
Would it be fair to say that if you're going from 2 days to 3 days, that would at least allow you to do a third increase in numbers served as a result of this?
That would be fair to say, because
That
I
makes
said between
Yeah.
30
Well,
to
but you also
40%.
said that you want to alleviate some of the stress
So,
of the
yeah,
day, so I
curious,
wouldn't
like-
expect it to be. Let's get the numbers from
Yeah.
Dr. Lepre if we could,
Yeah.
instead of making speculations,
Mhm.
okay?
And then I'm also just curious about how this would impact the schools, right? And where that interface lives.
I know that, I believe, the board is also working within the school, to do outreach and education. And, using the Boy Next Door film, we also created a list of documents that's sort of like a dialogue, question and answer that you could use with young people. You could also use it with work study groups that might be looking to, make improvements, to themselves, adults, meaning, that kind of thing. So as far as the school is concerned, there is plans to further do outreach into the school system, but they're already doing it. When we did the Run for Recovery fundraiser last August, and that was my first time with them doing this. I remember looking at all the photography that was taken the previous year and then looking at the photography that was taken last year. And it's so expansive in the participants between all of the high school athlete clubs were out there running and they all had their jerseys on. And then you have mixed families there. You have the very old to the very young. So when we launched the social media channels, which is about a month prior to this race or this event, the amount of followers that started following us, to me, was unbelievable because I've never seen that organic growth excel so much, which means that the brand itself already has the following. We just need to keep being out there with them. And the kids were all very enthusiastic when they were at that race and hung out afterwards when Dr. Lepre was giving his speech and talking about addiction solutions.
Michael, do you have a comment? Michael?
Wait,
Through
I'm not quite finished. So
Yeah, guys, we have to let the board members get their questions in because we're getting short on time. So
Okay.
Joanna, please finish.
So my last question is, are the materials that you have, are they translated into other languages like Portuguese or Spanish?
Yes,
Because
we're
I'm
in the
really-
process of doing that. Yes.
I'm really concerned about accessibility. In the school department's presentation of their budget last night, something like 39% of kids in the school system are Spanish. And 30% of them or 36% of them are English as a second language. And so we really need to make sure that whatever we're doing is accessible to everyone.
Okay, we also have a translator available in the office for Spanish-speaking patients.
So Joanna,
Yeah.
you're absolutely correct. And we have plans, we're working with Arlene on some of our outreach to translate our outreach into Spanish, and in the business director model, we also have that part of that person's position would be to help us do the outreach into the schools. And we have, I believe, actually, we put it in the grant that he would be working with the Spanish network and local Spanish communities. To answer your question about
I have to take over.
clinical,
I really have to take over because we're running out of time and I really have to allow other board members to get answers and questions in that have them. So Linda, do you have any questions? Sorry, guys, we just have to. Linda?
No, I don't.
Okay, thank you very
Dorothy,
much.
can I say one quick thing? This is Liz McCusker. I did go over to our house and met with the Spanish leadership group, Maria Partida, and made a small present. I was asked to go over, and the students were very receptive. I let them know that our information was going to be translated into Spanish and Portuguese, and that I would be going back with some of the board members again to review the film, and they've also sent me some questions that they'd like to have answered. So, and they did seem to want to participate. So just wanted to let you know that part.
Okay, thank you, Liz.
Yep.
John, do you have any questions?
John, you're muted, John.
John, we can't hear you.
He's still talking.
I think this makes it very clear to me, and I certainly support anything that we can do to reach this group, which obviously is up to now been pretty much underserved.
Okay, thank you. Bert?
No. I'm
Okay,
just
Veronica?
happy to see the group going forward.
Okay. I just have one question, because this is catapulting your organization onto a new level. What are, if and how much we can fund this, what are your plans for the future to sustain that level of funding?
That would hopefully be the outreach and education with the business manager working together to build a donor database that would, help be about 1/3 of the sustainability. The business manager would also be responsible for seeking other grants, which there are a lot of grants in the state of Massachusetts that an individual could go after and, help sustain that. So, we're not thinking about this as like a ongoing, we're going to come back to you and ask for more. This is really more about establishing the foundation that's needed to accelerate the growth, because they're growing anyway, like they're expanding. So,
One other,
What,
sorry, just one quick point is if we have a staff member that can help the patients that don't have insurance, obtain insurance for the state of Massachusetts, but we need a person to dedicate themselves to that so that the office does get reimbursed for the service.
can't they go over to the hospital? To the.
that's a clinic question. I wouldn't know.
No, but they can, there's a free service at the hospital for that. So that shouldn't cost you anything. That should be
Okay.
the hospital that by Massachusetts law is required to have that position available, which is in the hospital. And free to the service of everybody. Jericho, and then I have a question that we have other.
And this is just one last thing. Please reach out after this meeting. I've been working with an insurance advocate organization on the Cape that is trying to do more stuff on the island. So that might be a way to make it a little easier. Yeah, catchy. They've been trying to do the focus group and expand to do some more advocacy stuff here. So
They used to do stuff here. They got funded. Their funding goes to Cape and Islands, but they haven't shown up on the islands in years. But just so you know, it is a requirement by the law that the hospital provide this service. So,
Yeah.
Thank you. We'll make note of that. Thank you.
my question is, and I've had a little conversations with a few of the other organizations that I'm going to be presenting today is, I know that one of the key parts of a good Suboxone program is a good support, clinical support as far as mental health and counseling. That is a major part of most Suboxone programs. And I know that has been one of the lacking areas in addiction solutions, not saying, and what efforts are being made by the organization itself in collaboration with other organizations to enhance the counseling part of it, because, Suboxone is a great, all these are great tools. They're not supposed to be sustainable lifelong tools. They're supposed to have the integration of
Absolutely.
counseling and so forth, so that you can move on from that.
Right, and I can answer that easily. As a physician, prescribing Suboxone and other antidepressant medications, that works hand in hand with the patient's condition. They often, with the drug addiction problem, have a mood disorder. So that is treated with counseling, and we have another organization that we refer to, and we're very happy with their response. It's timely, it's expertly given. And we also have the ability to prescribe medication for psychiatric problems and refer out when we're unable to accomplish cure the more severe psychiatric problems.
And that's more current, and I just want to know the sustainability of that, the collaboration that is just now really becoming something,
Well-
I understand Fairwinds has come in as, at one point, they did have somebody in the office a couple of days a week, and I understand that came to an end. And I know that Fairwinds is now collaborating a great deal with.
Yes, and they've, what I understand from Dr. Lepre is that someone from Fairwinds will come to the office so that the patient will have counseling right away. We can get them right in with someone to talk right away, rather than give them an appointment at a later date. Dr. Lepre was speaking with them about that.
I want to know that that's going to be a sustainable part of the clinical program. That's basically, I'm glad to see the collaboration. I've, spoken with Fairwinds too, with Amanda the other day, a little bit about it. I'm really excited about the collaboration that's going on there. I know that that's a key thing that was missing. And would just like to know that in the long run, that collaboration is going to be stronger.
There's also,
That's the goal, Dorothy. That's the goal.
yeah,
Yeah, can't hear you.
Can't hear you.
We can't hear you.
Can't hear you.
Can you hear?
Lost
this?
audio.
How? Can you hear this?
yes,
Yes.
yes.
Okay, I wanted to say thank you very much to Addiction Solutions for their time. We wish we could go on for a long time having this discussion with all of you, but we do have other people that are
Of course.
in the window here that have to come in a very limited time.
We very much appreciate you.
So
giving
thank
us
you
the
very
time.
much very nice meeting you.
Nice meeting
Good
you.
luck.
Thank you all for the consideration.
Betty, very much.
Thank you,
Thank
thank
you.
you.
Keep up your good work.
Thank you.
We will.
Amanda?
Hi, Dorothy.
Hi, how are you?
Good. Hi, everybody. Hi,
Um,
Chris.
Hi,
Okay.
Christy.
Oh,
Oh, you don't sound, how are you? Oh, look at her tan.
She looks tan. She's in the warmth.
You look wonderful.
Okay, thank you.
Thank you very much. As you presented to us before, you know the protocol. We do need you to announce your name and the organization you were with, and then we'll have you do your presentation, and then we will ask questions. Thanks again.
Thank you. Thank
Mm-hmm. So, Amanda, if you want to start.
Sure. So, hi, everybody. I'm Amanda, and I'm the clinical director at Fairwinds.
Christy?
I'm Christy Wilson. I'm the operations director at Fairwinds.
Okay, thanks for joining us. If you want to make your presentation, please.
Christy, do you want to start and then I can?
Sure. So we appeared in front of this board about a year ago, seeking about $100,000 to support our peer recovery coaching, which is something that we started back many years ago with funding that we were able to get from Tower. And it was meant to sort of get it off the ground, and it did that. We do have still insurance reimbursement from Mass Health, and that's still the case, that it's only reimbursed by Mass Health, this program. And with the funding that we were able to get from the cannabis programming, we were able to hire, well, we've subsequently we've gotten 2 peer recovery coaches, and they've been doing some great work. And as part of our report, we did put in the numbers, but I'm happy to answer any questions about the numbers. But essentially, there's nothing like peer recovery coaching on the island as far as what this program does. It pairs people with lived experience who have been down the road of addiction and come out the other side to where they are living healthy lifestyles. And what we try to do is meet people wherever they're at, even if they're thinking about contemplating changing the role of substances in their life. And we don't make any judgments about whether or not what their decision is, it's going to look like for them. So we could have somebody that says, look, I just don't want to use heroin anymore, but I still want to drink alcohol, or I still want to use cannabis. Whatever that looks like for people, we say, all right, let's just start making a step in the right direction to a healthier lifestyle. And we know from other programs that some programs such as Gosnell, they have peer recovery coaching, but they say, no, you have to be 100% sober, at least back when I was in training with them. We didn't want to model our programs after that. We wanted to model our programs after something meaningful that people can say, yes, I'm not too scared to do that. I can take that next step with you. And it's really important, I think, to meet people where they're at, because it's such a scary thing to say, I can't use substances anymore ever again. That's a very scary thing for a lot of people, and they're not ready to take that step. So what we love about peer recovery coaching is, like I said, it just will meet them wherever they're at, and it allows for relapse, which is part of addiction is relapse. So what we're doing is taking these people with lived experience and pairing them with these people who need help, and they are making real change happen. Sometimes it leads to more formal supports where they might have a formal outpatient clinician. They may have medication management. They may have MAT prescribing, and maybe it doesn't. But the main thing is that bang for your buck, you're really going to get someone who deeply cares, who's deeply involved, who knows what it's like to be in that dark place and know that they need help to get out. And we're very, very happy that we have a program that can meet people where they're at.
And I just wanted to share, just from a clinical lens, as someone who's in recovery myself, when I'm working with clients with substance issues, I can't share my experience and what I went through. That's where the peer recovery coach can come in and really be that person that has walked in similar shoes and can share their experience and be more open and honest about it. This program really is successful, and, we've seen it grow, and we want it to continue to grow. We're interviewing someone today that hopefully we're going to hire, because we have people on the wait list, that are looking for peer recovery coaches. We have, obviously taken over Crisis since January, and it's been amazing to me to see, we've had a gentleman who called us who wanted to go to detox. he was connected to a peer recovery coach. And so that peer recovery coach worked with him over the next 2 days until he could get a bed at Gosnold and go off island. And this coach even literally took him to the ferry, made sure he got on there safely. And then we Ubered him to detox, from there, and then Ubered him back to the island. And he's now, been sober for, about a month, and he's working with his peer recovery coach and his therapist, and doing, med management. This is a very collaborative program in the sense that, given that we were granted the Community Behavioral Health Center, we had to collaborate more with other agencies to meet the needs of the program. And so, for instance, with Dr. Lepre, we look very closely with him and his team. My hope is that we will eventually get peer recovery coaches to go and work in the clinic 2 days a month, just to meet individuals to get them engaged in services. We had a situation with a crisis individual in the hospital, and Dr. Lepre came over, the peer recovery coach came, and myself and the crisis clinician to be able to work with that individual to come up with a safe plan for when they were able to leave. Even this week, we've had 2 individuals through crisis that we have connected with a peer recovery coach, because that's one of the supports that they need. So it's a very valuable service for those that may not find AA the best support. Having a peer recovery coach is someone that they can meet wherever in the community whenever they need that support. And if they want to go to AA meetings with the peer recovery coach, they can do that. But otherwise, they can just meet and grab a cup of coffee. So we've really, we've seen the need increase, especially since we've taken over a crisis. And our hope really is to keep, from a crisis perspective, keep people on the island and get them connected to the services that they need. And this gentleman that we worked with earlier, who, was really struggling with substance, we were able to get him an appointment with Dr. Lepre, med management, and then a peer recovery coach and therapy within a day. So that just kind of shows the importance of this service in terms of helping those, who are contemplating sobriety or wanting to remain sober.
Okay, thank you. I'm going to let questions begin. Joanna?
Hi, thank you, guys. Just a couple of questions. One is, so last year you were able to hire how many peer recovery coaches?
Yeah.
Was it?
Last year in the past year, we've hired 2. And then we're hoping to hire another one today. It's a process. Not everyone is interested in doing this work. But yeah, and we've had a lot of success with the 2 that we have. And given that we have some waiting on the wait list that would prefer to work with someone else besides the 2 that we have, that's why we need to continue to hire.
Okay, and the hiring plan is really like, what's the ideal number of folks?
Yeah. I would say, over the next, I would like to hire 3 to 4 more and hire someone that's bilingual. Just with crisis, we're seeing an influx in the need,
And I think I also noticed that the rate of pay for the peer recovery coach went up to the $76. Because was it last year? It was less. Yes.
Yes, went up a small amount.
Okay.
I think the challenge, that we find is just a lot of Mass Health reimburses, but a lot of people have other insurance. And so to be able to take that barrier away and be able to offer that service is huge.
No, I agree. Okay, thank you.
Yeah.
Okay, Linda?
I have no questions. I know the routine. It sounds good to me.
Okay, thank you. John?
I have no questions.
Okay, Bert? Bert? Bert, do you hear me?
He's unmuting, I think.
He's muted.
Yeah.
There you go. I couldn't get my screen unmuted. No questions. They've all been asked that I had.
Okay, Veronica?
I'm fine, thank you.
Okay, I do have a couple. Of course I do. How do you determine the clinical boundaries between your peer recovery coach and your clinicians that will see your clients?
So the clinician, the peer recovery coaches are paraclinicians. They are not licensed mental health counselors or social workers. So like I
Mhm.
share with myself, like when I work with clients with substance issues as a clinician, and I being in recovery, I can't share my experience. Whereas that's why I pair them up with a peer recovery coach, because then that individual can really share what it's like to go have their rock bottom or, work on their recovery. So
Right.
go ahead, sorry.
I guess my question is, how do they know the difference between giving, being a peer recovery coach and crossing the line into giving advice that is clinical advice?
But through a lot of training and guidance, I meet with them weekly to provide supervision. They know I'm a phone call, text away. There's times where, they need guidance around that. And I remind them that you're a paraclinician, they have a therapist, and the therapist can address those issues. So it's through supervision and ongoing training.
Okay, and this program started in 2017 with the Tower Grant, correct? And did it lose its footing for a while and then just come back and you found the need for it again?
I mean, I
Chrissy,
think
I can
sorry.
take that. So what happened was in 2019, we did have a lot of peer recovery coaching that was grant funded by the town and Mass Health. And we just could not sustain, we didn't have enough from the pool that we were drawing from for medication management and outpatient to also draw peer recovery coaching. So we had to really limit the amount that we were doing. And when COVID, it kind of hit at the same time when COVID started in the beginning of 2020. Most of the peer recovery coaching is done, if not all of it is done. It's not done on Zoom. So that a lot of the community-based services took more of a hit than the outpatient services with COVID. So between that situation being better as far as people meeting in person again and getting the much needed funding from this cannabis grant, we were able to put this back together again. But yes, it was very robust, and because of funding and COVID, it did take an unfortunate turn, and we're getting it back on track.
Okay, so your hope for sustainability is the fact that the insurance companies are now recognizing it as a form of substance abuse therapy. I mean, I nationwide, it's being used a lot. I understand the use of it now in all SUD programs, but and the importance of it. When done right, it's a great program. And
yes, and that is the hope. That definitely can take some time, and we've seen MBHP, the one Mass Health branch that is covering peer recovery coaching. They are typically pioneers in leading the way, where they did this with the Children's Behavioral Health Initiative, with in-home therapy and therapeutic mentoring. They set that standard of care, and then the Department of Insurance hopefully comes in and says, yes, now it's mandated that all of the commercial carriers need to sponsor or to fund this. We don't know when that might happen, but that's what we're hoping for.
okay, and are you seeking other grants to sustain this outside of the cannabis grant?
We are always looking for more money for sliding fee, and this is no different. We are always looking for more money for peer recovery coaching as well.
Okay.
And I think our hope is really, to expand this program. And since we're working so closely with the hospital now and Addiction Solutions, to be able to have the peer recovery coaches meet people in the emergency room that have a positive talks and get them connected right then and there, same as addiction solutions. You know, I did that when I was at Boston Medical Center. It was really powerful, you know, because after someone gets in an accident, they have a positive talks, having someone come and meet them and start the conversation, you know, really help them get into treatment.
Great. Okay, thank you, guys.
Thank you for your time. Have a nice weekend, everybody.
Oh, yeah, enjoy
Thank
it.
you.
Thank you.
Okay. And are we representing NAMI?
ASAP NAMI, yes. And Jackie is on the,
I see her. Hi,
she's
Jackie.
calling in from the case.
Hi, good
How are
morning.
ya? Good morning. How are you?
Pretty good. The sun is sort of shining, which is a good sign.
It's shining on me.
Yes. You have the spot.
I need a little warmth. Okay, I'm gonna ask you to give your names. And then, and your connection. And then we'll go into a presentation and then questions.
Awesome. My name is Elise Norton. I am the program director for ASAP.
Jackie Lane, I'm the executive director of NAMI Cape Cod and the Islands, NAMI on Nantucket, and we are in a process of merging with ASAP. So we're kind of one and the same in this.
Okay, I'm gonna let you guys do your presentation to us.
Okay.
All
You're gonna
right.
start off, Jackie.
Yeah, I'll start off, and if Elise sees anything I've left out, she can feel free to jump in. First of all, I want to say that this proposal is basically addressed toward the more adult population, those 18 and over, and there'd be a special emphasis on what we're calling the emerging adult, which is becoming a very popular nomenclature right now, as it's being recognized that people between the ages of 18 and 29 are particularly susceptible to addiction and mental health issues for various reasons. And there's a lot of research being done on that. The reason we're basically doing this as an adult for adult addiction and mental health is the fact that we do have other funding that is dedicated very much to 18 and under. So we wanted to do something different. I'm kind of excited about this. We came up with the idea of 4 really heavy duty educational forums that would be in the community. We would do one each quarter, and each forum would have a major presenter, hopefully live. And we have some people from Boston, some people actually from other places in the country that often visit Boston that are top-notch and very well known in the research that's being done on both ACEs and trauma, which have been now linked to the idea of addiction and mental health issues. This is fascinating. It's scientifically driven, and it's something that we need to know. I think the whole series, we believe very much in education. That's one of our 3 things that we do. And one of the issues that we need to think about with something like this, these forums, it's trying to normalize the conversation about mental illness and addiction obviously is part of a mental health issue, but normalizing the conversation, bringing it out into the open as a health problem, just like you would talk about a cardiac problem or diabetes, is extremely important to a community. And I think it's very important on Nantucket for a couple of reasons. Nantucket has had in the past a high rate of addiction and also a high rate of suicide, and suicide is tied into all of this. And it's also a very special place that is an isolated place. Even though it's a beautiful place and it's exciting and so on, it gets very isolated. And I think the end of February is maybe a good time to think about that. And I think probably most people would like a little bit of a break. The forums, the format that we are looking at, as I said, would start with a very high power speaker, which would cost money. Then I would like to have a panel. And the panel would be probably a mix of professionals and local people. And ideally, we would also have some people with lived experience from the island. These would be done ideally in a hybrid model, because I would love to have the live presentation, but I'd like to make them available to as many people as possible, and therefore we could do a hybrid model. We would also like to have interpreters that would simultaneously translate into Spanish and into Portuguese. In addition to doing the actual forum, each forum would be accompanied by a booklet or pamphlet that would be somewhat of a synopsis of the forum, but also would be a list of resources, both on island and off island resources for that particular issue. Some of the topics that we've talked about would be, as I mentioned before, the relationship between addiction and ACEs, which is ACEs is adverse things that happen to people, especially in very early, including even prenatal, postnatal, things that happen, abuse, very early childhood abuse, and what it does to the mind, and how it prevents the really great development of the mind, and leaves people more vulnerable to mental health issues and addiction issues. We'd also like to talk about, have a whole seminar or forum on the holistic approach to health, including mental health and regular health and psychological health, which is another whole issue. Another thing that we thought was extremely important was to have something about someone who is living with a person in recovery and trying to help them, both how they can help the person, what they can do, what they can't do, what's practical, and also how to take care of themselves. And then finally, as part of the Nantucket Behavioral Health Initiative, we talk very much about the continuum of care. And the continuum of care has like 4 parts. And one is the preventative, which is the education part. Then you have the intervention, and then you have the acute care portion, and then you have recovery. And we would like to explore that continuum of care as far as adult addiction services on the island, look at the gaps and see how we can fill them in. Again, the whole idea of this is to have input from a very stimulating, nationally known speaker, then have a panel, which would be professionals on the island, which would be a collaborative effort, as well as people that have had lived experience on the island. I'm doing something very similar for the League of Women Voters next month, and it happens to be on suicide, but the model that we're proposing is somewhat like that. And I think trying to get as many people from the community involved is very, very important. So that's kind of our plan. I think it could be a really good start to really a close examination of addiction on the island for adults, and also what's happening in the bigger world for addiction and where we can go from there. As far as funding, it's fairly expensive program, because if you're going to bring renowned speakers in, there is going to be a speaker's fee. There's going to be costs associated with all of that. I am always combining resources to try to do whatever we can do. And I would hope that at least a portion of this could be funded through the cannabis grant. So any questions?
Well, I'm going to see, do you have any
I
comments?
did just want to add that Jackie had started off by saying that education is a really important part of what we do as organizations, ASAP and NAMI. And to just reiterate that in saying that in educating our community, we give people the knowledge and the language they need to help either identify in themselves, you know, their symptoms, or in their loved ones or other community members that they care about. And that can be really helpful in the process of recovery if we can kind of gain the knowledge that helps us to understand better, like the roots of our, you know, addiction, or our loved one's addiction, or processes toward recovery and the tools that are available. So education is really important in helping people to be stronger toward, you know, improving their situation. And as we stated in our proposal, you know, we live in a very isolated community, and, you know, statistics are showing that, you know, rates of addiction and substance misuse are much higher in isolated communities like ours. So, you know, we feel strongly that there's a real need to bring, you know, this quality education to our community.
Thank you.
Yeah.
Okay, Joanna?
I'm good. Thank you.
Okay. Bert?
No questions.
John?
No questions.
Veronica?
None at all.
Okay, I actually don't have any questions either. I don't have any questions. Yeah, Linda.
No. I was wondering if you forgot me. No, I have no questions.
Sorry, I did forget you for 1 second there because I haven't really heard that much from you today. No, it was a pretty straightforward.
Exactly.
Yeah, very straightforward. Thank you very much.
Thank you.
Thank
Thank you
you.
all for your consideration. We really appreciate it.
Yeah.
Thank you.
Come back.
Enjoy your weekend and the
Oh, you
beautiful
too,
sunshine.
right?
Yeah,
Yes.
thank you.
Thank you.
I'm
Thank
just
you
gonna-
very much.
Thank you, Jackie.
Okay.
Where's my gloves?
John Balash, I can hear you.
Yeah, John, I'm gonna mute you real quick.
Sorry, what?
I was just gonna, there's a crosstalk there.
So lastly, we have.
Oh, you're good. Never mind.
Imperatives.
Health imperative.
Yeah.
And you do have.
We have Jessica. Hi.
Okay.
Hi. Hi, it's Elizabeth and Jess
Yeah,
here. So tell me, you guys finish what you need to do. Sorry.
Hi, thank you. Jessica, I personally appreciate the effort that you are making to be here today, considering everything. So thank you.
Of course.
Okay, who's the other person? And Beth.
Elizabeth
Yeah,
or
Elizabeth.
Beth or Liz, but
Or ET.
yeah, or ET. Yeah.
Yeah.
We were just on with some of you guys last month. Julia sends her regrets. She actually had to fly to Florida for a funeral.
And I
So
understand that you're at your mom's chemotherapy, so thank you for coming
I
in.
yeah, so
yeah.
I'm in Chelsea and there's nothing around in the city that I can go to. So I'm in the waiting room. So if you hear noises and if I have to throw a mask on when someone walks by, that's why.
Okay, we appreciate that. And so if you could just, both of you say your name and the organization you're here for, and that way we can, it can be on the recording, please.
Sure. So I'm Elizabeth Torrent, Chief Program Officer from Health Imperatives.
And my name is Jessica Cisternelli, and I'm the Director of Sexual and Reproductive Health at Health Imperatives.
I'm trying to turn where the sun isn't crazy in my face.
Okay, so if you can make your presentation to us.
Sure. So I think most of you are familiar with Health Imperatives, but we've provided services on island since 1977, I think, and transitioned from this model of sort of two at the time, siloed kind of standing programs to transition to offering obviously more services, expansion of services, but really looking at who we're serving and what the needs are of the population. And we're in many communities. So obviously today we're talking about Nantucket. And transition to a model at one point where we had a director overseeing and really doing the promotion and outreach and community work for all of our programs on Nantucket. when that person left, you probably all know Sunny, so I'll just say when she left a few years ago, it was really difficult. We weren't able to fill that exact same position. So we hired a site coordinator who was working on site to really do the operations, the day-to-day of the sexual reproductive health program. And even since that time, we've expanded more services. So we started providing medication for opioid and alcohol use disorder. We received the contract from the state to do Narcan education, overdose education, and Narcan distribution. And when this grant came up and we saw the opportunity, we thought, okay, what else can we do to serve the population with, in perspective of what we're offering right now, which is a lot of sexual reproductive health, infectious disease, and now substance use services. And what we really decided we needed was a person to come back into the site, because Lucia, who's doing the site operations, is really day to day. She does do some events, and Alice from WIC does a lot of nutrition events, but we wanted someone to go out and promote the services, particularly these new services, which are the substance use disorder program. We are actively recruiting. We said this in our last interview, but for a harm reduction specialist, a part-time. So, and that's funded by another grant, and that person will also would be able to go out and they'd work in our clinic and work with clients as they come through to provide the overdose education, Narcan distribution, but also provide some services in the community, again, part-time. And so the position we're looking to hire and fund through this position part-time, because we realize this position wouldn't just be focused on substance use disorder. It would be focused on promoting all of our services, providing education and outreach in the community. We would love to get into the schools around substance use and doing some prevention, but also promoting the substance use disorder program we have right now, which is offering Narcan, providing the education, working with partners, and just a more comprehensive approach to the substance use disorder services. And we obviously know that there are other people in the community offering treatment, counseling, and connecting, and making sure that the 1,000+ people we reach in our program, and then the people out in the community are connected to whichever services they need. So I hope this makes sense. Please ask questions. Jess, jump in if there's something I missed. It's kind of just that I know we don't have a lot of time, so it's kind of like the brief overview and the model. And I know some of you are more familiar with it than others, so please ask me questions if you need clarification on that.
Yeah, I think I do need a little bit more, but Jessica, do you have any way of any information?
Just that the, also in addition to substance misuse treatment, the harm reduction specialist, we know that not everyone is ready for treatment. So the harm reduction specialist will work with folks into how to reduce the risk of their substance use. So safer ways to use, never use alone hotline, giving out safer use supplies, connecting with folks wherever they're at in their journey of their substance use or misuse. Are they ready for a connection to treatment? Do they want to, smoke instead of inject? Do they want to, make sure that they have Narcan in the event of an overdose? Are there community members? Of course there are, who are impacted by their loved one's substance use. And so we could offer Narcan to bystanders, to friends and family members, to other community organizations, so that they can have Narcan in the event that they witness an overdose. And making sure that, everybody has basic CPR skills, training. And so this outreach position would work in support and collaboration with that harm reduction specialist to make sure that we're reaching all the folks on island who could benefit, whether they themselves are using, whether they are a community partner, whether they're a friend and family member, to support this initiative.
And the position that we're looking to partially fund from this grant opportunity is would work and supervise the harm reduction specialists so that they're working in conjunction with each other and coordinating their efforts.
Mhm.
Thanks, Jess. That's really helpful. You have the clinical perspective that I don't have.
Yeah, I think one of the key things, I'm just gonna put out there, to the group is the fact that, Health Imperatives works more with the immigrant population than anybody else in the community. So they're within the community that is really hard for everybody to reach. Is their specialty. And then I think that's a key thing that you ladies, sorry, I think you're so used to it that you forget the importance of that within our community.
Yes, please. Because I don't know everyone who's there and I recognize some faces. So no, some people are familiar with us. But you're right. We've deliberately and intentionally prioritized populations, again, differently in different communities. But in Nantucket, particularly immigrants, people who have barriers to accessing health, whether it's language, financial, I mean, the lack of insurance for people with lack of insurance there, or even if they're on, like, I think we wrote in the grant, catastrophic, but it doesn't cover prevention or doesn't preventive visits. So people aren't getting the care. So we've really focused on making sure people know that they can come in, that we accept insurance, but we also have a sliding fee scale, which most people actually end up paying very little or nothing to come in for services because of the wonderful support from the community, the town, community foundation, and our funding sources state that help support us in providing services to people that can't pay, but need services just as much as anyone else.
Okay, I'm gonna let everybody ask questions. I have a couple of questions when we get to the end. So Joanna, I'm gonna start with you.
Okay, that's good. Hi,
Hi.
Thank you for sharing all of that information. You know, when I read this, I thought I didn't really know that you were doing all this work in this area. So I really appreciate it. And I'm not sure also, to Dorothy's point, that it's widely known. And I particularly appreciate that you are dealing with a lot of the minority population on Nantucket. I think that's very helpful.
You speak to one of the issues that people don't still more people know about us for sure, but that is kind of the conundrum, is getting the word out there.
But I think it's really of interest that that population feels supported by you and that they can go to you for a resource. So I'm wondering, how do you capitalize on that, right? Like how are you attracting and staying in contact with that group?
Yeah, that's a good question, and in different ways. Obviously, we can't do anything without our community collaborating partners. So being out in those meetings and making sure people know about our services and can connect people that maybe similar population of that they serve. You know, we provide WIC services, word of mouth by priority populations is probably and always has been the best way, the way that referrals are made. If someone comes in and they find out and they tell another person, and it can quickly generate that way. Last year we did radio ads. We obviously go to events where people are. We provide the education, and in different settings. We have staff who reflect languages spoken on Nantucket, mostly Spanish, the biggest population. I'm trying to think of other things that we do so much. There isn't like a perfect way to do it. It's just, it's sort of hitting at different points. Jess, I don't know if you have any other.
No, I was going to say, I mean, word of mouth is huge, and having staff that are from the communities we want to serve have been huge for us. So once we were able to we didn't have bilingual or bicultural staff on island for many years. Once we were able to hire the staff from the communities, we've seen a dramatic increase in folks accessing our services. So knowing that our staff are there, that they speak the language, that we're warm and welcoming and inclusive and non-judgmental, and all of the things that I think make Health Imperative so great, if I don't mind saying that. then, you know, that folks have a good experience and then they're comfortable to share that. And then another person has a good experience and they're comfortable to share that. And then when we have folks out in the community, so when we had Sunny, you know, she was able to articulate that to our community partners, to potential clients, and link them back to the clinic or to the WIC program or to the Healthy Families program. And then from there, you know, word spread. So I think being able to, with the support of this grant, invest in an outreach person that can do that for us again, as well as having the staff in the clinic who are able to build those relationships, I think is how we're able to stay engaged.
Yeah, and presence in the community. I mean, when we changed our model to, we used to have people fly over, and it just wasn't a great model with the travel and the airplanes, and having people from the community who can share they don't go back to Hyannis, they come into the community after work and they share their information. It's been key, though a struggle. It's you know, as you all know, the hiring, it's difficult these days. So we've increased our hourly rates 3 times in the last year. So, and we have a differential for Nantucket. So we're really trying to put our mouth where our money, how do you say that? You know, we're reaching out
Money
to
where your
communities
mouth
and we
is.
want to pay them a living wage, and we want to pay all our staff a living wage, because in Nantucket, that's really difficult. So we acknowledge that and are trying to meet the need and what the demand is. So we're hoping that we will find someone.
Thank you.
Okay, Joanna, any other questions?
Nope, that's it.
Okay, Bert,
No question.
John?
No further questions.
Okay, Linda,
Questions?
no questions?
Nope.
Okay, Veronica?
I think I'm good for right now.
Okay, you do know that, I just need to make this pretty clear in reading this, that we, can in no way,
Narcan.
support the financials of the purchase of Narcan.
That's provided to us free from the state as part of our contract.
Okay, I'm just letting that be known that that's part of, that we are not allowed to do that.
Sure.
Okay, I think that your report sort of tells us all my questions. That was my only statement I needed to make to you and make clear that the one thing is that you are working with the demographic in our community that you serve better than most.
Exactly.
Thank you.
Yeah, so with that, I don't think anybody has any questions. Linda, you said no, correct? Just a minute.
No
you guys can
comments.
go- Okay. Okay.
Thank you for
So-
this opportunity, for the grant opportunity, and to meet with you all and clarify anything that we need.
And thank you for the very short notice and for, you know, coming to us, especially, you know, in circumstances that you are. We appreciate it a great deal.
Love our jobs.
So much.
We want to make this happen and we're excited. So thank you so much.
No, thank you, guys.
All right. Take
Take
care.
care.
Bye-bye.
Bye.
Okay. We had 4 very different presentations.
But what was very interesting with reviewing them like this, we have 4 organizations that are serving different areas, but also in many ways are meshing the way that they should be.
Correct.
And that's exciting to see.
Isn't it exciting?
It's very exciting to see.
This is very new, just so you know. It's
Okay.
very new over the last year.
Okay.
Okay, so what you're seeing is something that we have sought for many years. And yes, I think we all
Yeah.
agree that it's really cool to start seeing
Yeah.
how their hard work is paying off as they're really coming together as an entity. And the biggest thing about this is that, you know, not only does it improve the services available, it improves their ability to seek further grants on a national and state level. And that's the key for them. They can become a very financially much more stable programming through actual signs of collaboration that are actually working and being able to prove it in the grant process outside of our grants.
Yeah.
So it's really, the whole thing is beneficial to everybody in the community.
And another comment, I guess I look at NAMI doing their outreach and education, but they're focusing on that emergent adult, 18 to 29, going back to how we started the meeting with programs in the school. It just tells me that that is so much needed, that we've got these organizations that are handling the adults, touching a little bit, I guess, on kids, but that need in the school is so important.
It's huge.
So
It's huge. I agree.
yeah.
Okay,
Hello? I
hi,
just,
John.
yeah, well, no, I really wanted to note what Dorothy was talking about, the fact that this collaboration, which we've seen evidence of today, is almost, I won't say solely, but Dorothy has been such a driving force over and beyond what we as a committee can do outside of the committee, bringing it back to us. It's just, I just think that needs to be recognized and put on the record, since we are recording.
Thank you, John. That's very sweet of you. But I would
Not
say.
sweet, it's true.
Okay, thank you very much. That's very sweet. It is very sweet of you, though. Okay, what I would like to do is go forward in discussing this cannabis funding and the grants that have been presented to us.
Okay.
Okay. We are going, it's right here. Are you looking for this? I gave one. I already gave one to Veronica here.
Sweet.
Yes, NAMI is asking 50,000, not 100. From what I, just looking back, and that was a.
Yeah, so that might be where that extra 50,000 came from. That when I changed the number.
Okay, where's NAMI's, do you have NAMI's thing?
Yeah, it's
Yeah,
50,000.
50,000.
Yeah.
Dorothy,
Somebody go back in the letter.
Dorothy, I've got a question. So
Yes,
how does this impact we had discussed for the other funding, right? Like who's coming out of that now? Right? So, because I think I need to understand, I need to look at this a little bit more holistically, because, right,
Yes.
are we taking addiction solutions out of the other
Well,
category?
the addiction solutions was not awarded any money in the other category.
Right.
So, and because depending on how we come today to this, it was waiting on the cannabis grant, and until we made our recommendations today in the cannabis grant, we would then approve the other human service grant as we had done it, because we hadn't seen this. So we had to make sure that they were in it.
Okay, so they
So-
were not in that. Okay, got that. But NAMI, Fairwinds, and Health Imperatives are all on the other sheet as well.
They are on the other sheet, yes, and they are all under the other sheet for other programming, but they are as is right now. Yes.
I have a comment on that, by the way.
Yeah, one second. I just wanted to ask Joanna. Joanna, I know that you have limited resources with you. Do you need to know the funding levels we gave everybody, or?
Yes, I do also.
You do.
Linda? Linda?
I need that amount also, so I can write it down on my sheet here, but I asked Jericho if he went through those other entities' requests to see if there was any overlap between the cannabis request and the original request for the other grant, and apparently there isn't any overlap. But I'll leave it to Jericho to explain if there is any and what it is.
No, I mean, I already said there is no overlap, right? It was very clear in their request that there is no overlap.
I'd also like to know where we ended up on the funding so far for everybody else.
Linda, I'm gonna take a picture of the cheat sheet and text it to you.
I have my cheat sheet in front of me, but I don't have the final figures that we made. Is that
That's
what you're
I'm
sending
saying.
me?
Yeah.
Don't text it to me. Can't get it on a flip phone.
Email
Yep,
to the, which one?
X Arena,
Okay.
X Arena 1, Gmail. Somebody's buying me a fancy phone, but that's not coming anytime soon, and it'll probably just sit in the box in a corner.
They don't want.
Gmail.
Okay, we don't really have a lot of time on this. I've been given, I have till March 9th now, because I requested from Libby till March 9th to get into FinCom, and she approved it. Denise approved it. But I'd like to get on to this.
How did it got all switched up?
And
Just
recommendations.
discussing, Dorothy, are we just discussing cannabis right now?
We are just discussing the cannabis funding. We are not discussing the approval of the full CRC funding at this moment, just the cannabis
Okay.
funding.
I just have an issue with one of them. That's all.
And, well, on that note, I think, Linda, what is your issue? You want to go forward?
I
and
think
tell
it's
us?
with NAMI. It's just sticking in my head. Maybe I missed it. Because I'm home with a bunch of infections from a dental surgery this week. I thought they had already combined themselves. I thought I heard her say somewhere in that presentation that they were undertaking combining NAMI and ASAP. Did I miss that?
Well, no, what it is the official, last year they started the combination. It became official this year on all the, because they had to go through a year process in it.
Right, but I thought she said in her presentation that they were still working towards combining them. That they
Yeah,
had
but
not combined them.
No, they have, what they is that as of this year, it'll be a joint.
ASAP Nami?
ASAP NAMI, as of this year will become, they were merging and now the merge will be official.
All right, because I understood it was not official yet.
I think this fiscal year is when they
Right,
officially unite and are operating under the same 501c.
Right.
Now, I believe NAMI is operating as a pass-through for them.
Okay.
For ASAP.
Now,
And they
my,
would
so my
post
issue
NAMI.
with this is that I think we have at least 2 out of the 4 are established programs. And we only have 175,000 to give out, and we have again $453,000 worth of requests.
It's-
That's where I'm
it's
trying to,
actually
that's where I'm trying to parse it down to
Okay, it's-
somebody getting something.
it's 403,000. There was a error. The NAMI request was for
NAMI's
50,000.
Yeah, I got that.
Okay, so it's 403,000.
I'm still having problems at 403,000 with 175,000 to give out. We should probably ask for more because the town's just sucking up the rest into the black hole. But I'm trying to figure out where to go with this.
This is calculated off of sales. right?
Yeah, this
Right,
is we
this is-
can't ask for any more money from this. This is actually, this is off of the tax sales of the cannabis grant. And right now, it's actually in the middle of, we're having to do research onto whether this cannabis grant is gonna be part of an impact study mandated by the state on the cannabis grant. So right now, we are lucky we have this 175,000. I think
Yeah.
the towns try to approach this, that this is an impact within the community and keep this. But the 175,000 cannot be changed because
Right.
this cannabis grant comes from tax dollars. So we're gonna take that off the table and we're just gonna go ahead and start talking about the organizations and their impact. The one thing I think I'll make a little statement is that each and every one of these looks like it can provide something within the realm of what they do, hitting different sectors of our community that are key. If you look at Fair Winds, and just so everybody knows, Fair Winds, when they presented, as of February 15th, they'd only used 24,417 of their 87,500 grant.
I know.
Using 5,000. So if you took that 5,000 amount, they're at 63,000, maybe between 63 and 70. I mean, they're going to be lucky if they hit the 87.5 given to them in the grant.
Right.
One of the things that we learned last year is that if they, There is a possibility if that grant money, if we know before that grant money isn't used, that we can put in a clause, that we can ask the town to make a special contract allowing them to use those funds further. But we have to be able to do that a month prior to the time this happens, and it's like a special request within the grant, within this, but it has to happen. And we found this out after, we learned this last year,
Right.
or this fall, Jericho, Ann and I.
Right.
So I think that looking at the fact that they didn't use the full 87.5, and no, I'm not saying that, looking that they could projectively not use it because they've used very little up into, we're into the third quarter
Right.
of payments right now.
And they also only have 2 peer recovery counselors right now. They want to hire. So they're gonna be ramping up, and ramping up to $100,000 maybe with what we've seen, it's just not gonna happen.
It's not gonna happen.
It would be wonderful, but yeah.
It could be out of the question. And so with one of the key things that we were talking about was education, and and getting it out in the community. One of my concerns at the very beginning, and I think I asked this, was what about that crowd from 18 to, that's been, that to me has been this lost community that we've had here. So looking at everything, I'm gonna put this out on the table because we don't have much time. I'm wondering whether we make a recommendation of 25,000 to NAMI. 33,000.
I couldn't hear that. I still can't hear it. Somebody needs to mute. There's a lot of background noise someplace.
John, can you mute?
I got him. I got you, John.
All right, what was that?
Okay, I'm making a recommendation of 25,000 to NAMI, which is half of what they're asking us towards educational program.
Okay.
33,400 to Health Imperatives, because they are, and they aren't, Addiction Solutions is not the only medically assisted program on the island right now. And this one really works with a group that really trusts, believes, and Health Imperatives has proven to us they do their business, they do it well. And then we have 58,000, I think it's 58,400 that we could give to both organizations to round out that 170.
I can't hear that.
Or we could give 58,400 to both other organizations, rounding out to the 170.
Linda, we can just fill it out and hold it up. It might be easier. I think you're correct.
No, the owl is not functioning correctly. It's like picking up every other word.
Yeah, hold on. I'm gonna mute and unmute. That fixed it when it was
I can hear you. I can hear you, but Dorothy may be just 1 inch too far away from that thing.
That's funny, I'm closer to
We're gonna
it.
get you closer. Put it in.
Okay, Linda, can you hear me now?
Yeah. How did you arrive at the 58,400 for the other two?
That is the difference of 116,060 left over. It is, we could actually, the other analogy would be give Health Imperative, Fair Winds just 50%. The other two are 50% of their requests. Would be give Fair Winds 50% of their requests, which would put them at 50,000 and make it 66,000. 66,600 for going towards Addiction Solutions.
Yeah,
I would rather that. I just think Addiction Solutions is fairly established. They have shown that they're got their act together now with the board and a budget and fundraising and everything else, which is what you and I spent a lot of time talking to them last year in the office. So I think, I'd rather give them half of what they asked for, but we've got a bunch of people in here asking for stuff, which is, I understand giving them 50%, but I think the 66,600 is better than the 58.
And then giving
Me.
50,000 to Fairwinds, that would be my other, so it's basically half and not quite half. But considering the fact that some of their money was towards education, for addiction solutions, I'm hoping that within these other realms, we're getting some of the education underneath our belt. And I
I'd
know.
rather
that
give,
we
let me, one more comment on my side. I'd rather give nothing to NAMI and give that 25 grand to Addiction Solutions. That's just where I'm coming from.
Okay.
Until
I
next
just
year.
think- I think that they provided some programs that have, NAMI through with, ASAP that have actually benefited a lot of people in the community. On a broader spectrum.
Dorothy?
Joanna?
So I just typed in the chat because it's loud where I am, like, I'm not far from where you are, but I, like Linda, I think that Addiction Solutions should get more money. And so I'm proposing 75 to Addiction Solutions, 25 to NAMI. That makes 100, and then the 75,000 that's left can get split between Fairwinds and Health Imperatives, which is like, 32.5,
37.5.
37.5, sorry. So
No
that would
worries,
go with
I have
that.
the calculator in front of me, so.
Yeah.
So
So what are you proposing, Joanna?
I typed it into the chat. I'm saying 75 to Addiction Solutions, 25 to NAMI, and then 37.5 each to Fairwinds and Health Imperatives.
Wait, no, hold on. Yeah, 37. Yeah.
All right, now run that. That's 50 to Fairwinds or less than 50 to Fairwinds.
Less
It's
than,
less than.
it's
less than-
37.5. I
Hold on.
agree with Dorothy, I agree with you. I think they're gonna have a really hard time. They've had a very hard time staffing this program, and I don't think that's gonna change. And I think that we should go back and ask that they can use the rest of the money from last year. And with this 37.5, I think that that will be fine.
Yeah,
That these
Yeah,
peer
I-
recovery coaches are not gonna drop out of the air.
no, I don't think they are.
All right, so run that again, 37.5 Fairwinds, 75 Addiction Solutions. What does NAMI get?
25, and then
And what is Health Imperatives?
37.5.
I can go with that.
Yeah, I like it too.
You had 50 you had.
Okay, so what, right now on the table, Joanna is saying 75 to, Addiction
Addiction.
Solutions, 25 to NAMI. And 30, what was it, 30
37.5.
to our other two parties?
Yes.
Health Imperatives.
Okay, do we have a second on that? Or any discussion? I'm sorry, do we have discussion on that, please? Is there any? I hate this camera.
no,
My favorite was when Anne was on there like 3 times. They had like the corner one, the middle one, the actually her, and then the one.
Okay, I'm gonna ask if there's any discussion on this.
It's a
I'm
good
happy with
proposal.
it.
It's a good
Okay.
proposal.
So we have no discussion except for the fact that people are happy with the proposal. So with that being said, Joanna?
Motion.
So I make a motion to advance 75 to Addiction Solutions, 25 to NAMI, and 37.5 each to Health Imperatives and to Fairwinds.
I'll second
Okay.
that.
Okay, Joanna,
Yes.
Linda,
Yes.
Bert,
Aye.
John?
He said aye. He's muted.
I need to hear, we need to record it.
Aye.
Thank you, John.
Thanks, John.
Veronica? Okay, and you can say that was an anonymous decision on that one.
Yeah.
Then if
Can I
we
make a
could-
motion on the other one, on the ones we already came up with on the regular grants? I just went
yes,
over them again.
I would like an approval of the funding.
I'll make a motion to approve Safe Place at 70, ASAP NAMI. Oh, what am I doing with that now? ASAP NAMI 94,800. Elder Services 21,600, South Coast Legal 4,600, Interfaith 85,000, Health Imperatives 150. MVY 17,000, Fairwinds 150, Small Friends 20, Artists Association 20, and Sherburne Commons 17. That's 650,000.
Yes. So we have a motion on the table by Linda.
I
Do we
will
have a
second
second?
that.
Okay. Linda,
Aye.
Joanna,
Aye.
John,
Aye.
Bert,
Aye.
Veronica,
Aye.
aye on me. Dorothy, aye.
Do we need a motion, Dorothy, to send the letter for the increased funding that we got today?
Oh, we
or the
already,
other day?
did that. You missed it. We
Okay.
already did it.
All right, good.
Thank you.
Good.
Dorothy, when are we gonna send that letter?
It's gonna go today.
Thank you.
And
Yeah, okay, with the one time, yeah, okay, got it.
it's, yeah, the one, it's a one time. Linda, we're asking for this money one time because the hope is that it's gonna go into the school budget.
Okay, works for me. Now, do we need another meeting to review the report before you put it in?
We'll have to do that, but we also have to do something on
Oh, the
the
quarterlies. Yeah.
quarterlies got missed in the agenda when we redid the agenda. So we have to do the quarterly reports so that they can get paid.
And there was really only one major issue on that, and that was with the reporting with Gosnold, which was late and very incomplete. And I just wanted to bring it to your guys' attention before we approve payment on it.
Well,
Nothing,
also I
no
have-
surprise there.
Me
I mean,
either.
that was the only one from my side. I'm sure there's plenty about, like, I'm sure there's a lot we can talk about.
I think we have to leave it for discussion because I can't talk about it right
Yes,
now, but there
Yeah.
is concerns over that one, so.
Dorothy, what I want to know is, should we try to attend the select board meeting where they'll consider our request? Because I think that if we have some voices added to that, it would be good.
Yes, I do think that
usually
we
do.
should. So once I find out, no, she's talking about the additional funding. Is that what you're talking about?
Yes, that's what I'm
No.
talking about.
All right.
As soon as I find out, I'll give it to get it. I'm gonna have Ann and I will make the couple grammar changes and get it out, and then I'll ask Erica when it'll be on. I know
We
that.
gotta
Libby's
schedule
going- I know they're
What?
going away. Libby's going away for 2 weeks. Am I correct?
Yes.
Yeah.
Who is? Oh, Libby.
Libby, and what you missed earlier was, Linda, that Libby and Brian, I saw Libby, I talked with Libby a little bit about it, a discussion, an email has gone out to Brian. So it's not like Libby and Brian don't know it's coming down the pike, and I believe that Denise already knew it was coming down the pike, so.
So,
Do we need to
yes.
set up another meeting date right now, though?
Dorothy, can I just say something about that? We have, every year there is a $500,000 in free cash that is reserved for emergencies or things like this. So there is the ability for the finance committee to certainly make a recommendation that where we can take the money from, right? So the money actually exists.
Oh, okay.
They don't like to take stuff from free cash, though, do they?
No, they don't, but other things have come up. And it may not be, it also may not, there's money in free cash, but there's also like reserve money for unexpected expenses. And this would certainly fall into that category.
Let's
So
set a date.
Joanne, can I just ask a question on that? So, free cash and reserve funds, so for infrastructure issues comes more out of reserve funds? Because,
Like,
say,
I'm trying to
if,
think about, I'm trying to think of a good example to give you, like when the sewer main broke.
yes, that's what I was just thinking.
That was a time that we, had to appropriate additional funds, right? When budgets go, I think another time was maybe when the PFAS thing happened.
Right.
And we had to spend it's for unbudgeted expenses,
Okay.
right?
Jericho has a statement.
Okay.
Quick question regarding this. Would we be, assuming we secure this money, will be initiating another round of RFPs to solicit proposals for it? And
Correct.
if so, on what timeline are we delivering it?
Well, we just have to do it before, we'd have to get it done before town meeting,
Okay.
so it would be rushed.
Okay, I'll start modifying the existing application thing now in the assumption that it's going to happen.
With hopes that it'll happen.
Yeah, sorry, with a firm belief that it should happen. But regardless, then we'll get that all together. And then I will submit that to the board for you guys to take a look at. And then I'll try and have that ready well ahead of time for when we get approval for this.
Okay, so we have, March 9th is the date to go that I have to Everybody, I'm pulling up my phone just to look
Yeah,
at the calendar.
I'm looking at calendar too here.
Well, obviously, everybody who's got kids are not here next week.
I'm going away to see my grandkids.
Yes, that would
Yeah,
be
so
me. I'm.
I would
I'm
think
all for it.
Monday, maybe the 6th, since you have to turn it in by the 9th.
I have to turn in by the 9th. You guys are gonna have to give it to me for. Can we do the morning of the 7th?
I can't,
In
I've got
all
harbor
honesty,
plans.
I'm trying to take some time to be with my grandkids. And I'm gonna be gone until Friday. So that makes all next weekend and whatever time I can put in tomorrow. So,
I've got, I have a harbor plan meeting that morning.
I have coastal resiliency, but I'm not back on the island until the 8th. I could do something, but not Monday. I'm flying.
Okay. What
And I
about
can-
the 8th then? Oh, geez.
I'm not
Day
available.
before. It could be, I could join something on the afternoon of the 7th.
the only problem is that,
Is that a Tuesday or?
it's a
Tuesday?
Tuesday and does passports on Tuesday afternoons.
Can we schedule it in the morning?
That I
I
just.
can't.
tried that and I can't do that.
I
That's what
I
just-
have coastal resiliency and Linda has harbor plans. We're so busy
It's ridiculous.
and that's not even the real job.
I can do it. I can do it in the afternoon of Tuesday, but it has to be way before 4 o'clock because then I have
Exactly.
HDC at 4 o'clock.
Yeah, I
Yeah,
have
but-
finance committee.
I hate Tuesdays. I really do hate Tuesdays.
What time do you go down there? Maybe? Yeah.
All right, but you guys will have to decide because I have to go. I actually have one more call.
Can we?
Have to be before 12.
Okay, forget it. We'll figure it out. We'll get in touch with you, Joanna.
Okay. Bye-bye, everybody.
All right, have fun.
Thank you. Bye, guys.
Or Wednesday morning. I mean, I'm fine on Wednesday morning, whatever time.
Yeah, I'm not available Wednesday through Saturday of that week. I'm in Italy, so I can't.
We can still do it Tuesday afternoon at 1 o'clock and just won't be there.
Somebody else left. She said we can do it Tuesday at 1 o'clock with somebody else.
Well, I said that, but who's gonna take the minutes? It's not gonna be me.
Well, they can always watch the tape. That's how we take minutes at the HDC, in fact.
I did trick an AI to summarizing the transcript of a meeting once. I don't know that it's gonna do, I don't think my beta test of it should be for that particular meeting. But if we want to go through the transcript, I can work on that with you later.
Okay.
You just watch YouTube. That's how we pick them up. After the fact.
Well, as long as he pays you to just sit and watch YouTube and you don't have to do it at home.
You know,
I'm
we're
okay with
not- No,
that.
this is on the clock. We're not making you go watch YouTube Nantucket government YouTube at home.
You don't have to submit yourself to the.
All right, can we do it like 1 o'clock?
I could do 1 o'clock on the 7th.
1 o'clock on the 7th?
Yeah.
Okay. I just have to confirm that it might possibly be an eye appointment for me on the mainland that I've been waiting like 9 months for, so. As of now, we'll take it can you put in for Tuesday, the 7th at 1 o'clock? John and Bert, would you be able to do that?
Well, you're gonna be cutting in on my sun tanning time, but I'll come in.
I could do it.
Oh, you guys, I don't even want to hear it.
I know.
Chime in from the
I mean,
beach.
Hyannis looks pretty good to me right now, you know what I mean?
First time I've ever heard that sentence.
Linda, we're keeping that for recording for you.
Yeah.
Okay, just like warmth.
That's gonna headline in the Inky next week.
I just turn my heat up and sit in front of a window. That's what I do.
I go north, I'm crazy.
And what did we do? We had like an hour of sun this morning and now it's gone again.
No, it's still there. you need to open up a shade. We saw
Come-
it.
did.
to come more into town, yeah.
It's not as bright as it was.
No, it's not.
No.
Well, it's sort of going this way, but it's there.
We're gonna
There's
get
a big cloud.
whacked, aren't
Because it
we?
was, camera was beaming in right up to the.
Yeah. So it's
All right,
the,
so what we're doing on the 7th is going over the quarterlies and approving the report. Is that where we're going?
correct.
Okay.
Okay.
And it will probably be a draft report.
Okay.
Yep.
It will not be the final report. There's no way it can be the final report.
And go ahead and just, Dorothy, just ship it back and forth to me. We'll figure it out. While you're gone or whatever.
Oh, it's not, this guys, there's so much research that goes into this. There's no way this is gonna be a draft, you know. They'll get a draft and we will, and if I feel, you know, we'll see. If the draft report isn't done, as long as it's done for town meeting, that's what matters.
Well, if you want to ship, just do it section by section, just ship it out section by section. Not the whole thing.
It is,
May something?
yeah, it's not easy.
Well,
Okay,
Isn't, it's May, early May this month?
Yes, May, yeah, it's beginning of May.
yeah,
May 7th or something?
Yeah, I think May 6th, May 6th.
Yeah.
Yep.
okay. Okay, everybody,
Motion two?
I need somebody to make that.
Motion to adjourn.
Magic
Second.
motion?
Second,
Okay, Veronica,
Aye.
What is it, what time is it?
Linda,
Aye.
John,
aye.
Bert,
Aye.
Dorothy says aye.
Can I steal another piece of cake?
Thank you,
That was
Have a
really
fun
good.
house, school vacation.
thank you, you too. I
Oh,
hope you
yeah, I
feel
don't
better.
do school vacation anymore because my kid is 26 and he still lives at home.
This is coming to
We'll
you
fill
to
that.
bring over there.
Oh,
I'm
okay.
not bringing it home, so.
I've always heard about this, you know, this New Jersey.
It's